Although Africa is home to 67% of individuals with HIV, it is still a major problem here in the United States. 50,000 people are newly affected in the U.S. every year. Although education is still improving, many misconceptions about HIV and AIDS still exist. These misconceptions are the cause of much of the stigma those with HIV face. Due to stigma and fear, many people don't get tested as often as they should. 1 in 5 people infected with HIV do not know they have it. Education and demystifying HIV is a key step in prevention. With the advancements in treatment of HIV and the medications now available, having HIV is no longer a death sentence.
So people would come in with a median survival of 6 to 8 months. It was a very dark period of my medical career because virtually all of the patients died in less than a year. If you fast forward now with the development of a whole menu of more than 30 drugs, which when used in combination can remarkably transform the lives of HIV-infected individuals, if a sane person today, 30 years later, comes into our clinic, let's say a 25-year-old man or woman who comes in who was recently infected with HIV, and I put them and they take the medicines of the combination of drugs that are available, you can mathematically predict and tell that person that they can expect to live an additional 50 years. So the advances that have been made have been most extraordinary over the last 30 years.
HIV is a virus that damages the immune system. HIV leads to AIDS, which is a collection of opportunistic illnesses that one gets due to the damage to the immune system caused by HIV. The progression of HIV to AIDS can take anywhere from weeks to over 10 years.
I was infected through the use of tainted blood product treatments as a child, used to treat hemophilia. And I'd received hundreds of treatments in that window period when they were most susceptible to being contaminated with HIV, which is the early 1980s. I was born in 75, so I had a lot of stumbling, bumbling injuries. I had chronic nosebleeds growing up. And so yeah, it was just as simple as going to the hospital, getting an injection of concentrated blood plasma, and then I was back playing with my friend.
HIV is an equal opportunity disease. It can affect anyone, but you can protect yourself with the proper precautions.
There has never been a case of HIV being transmitted in a normal family living situation.
It cannot be transmitted by hugs. It cannot be transmitted by casual contact.
Without education, people living with HIV will face stigma.
At the playground. From neighbors.
Anywhere.
HIV cannot be spread through casual contact, mosquito bites, or kissing. It can, however, be spread through oral sex.
People don't realize you can get it from oral sex. A lot of people still think you can get it from mosquitoes, which you can't. And some people still believe that you can get it from using other people's eating utensils, and you can't do that either. A lot of people get confused that HIV lives in saliva, and it doesn't.
And when I finally let it sink in that I was pregnant, I was just so happy that I could bring another life into this world. Because I knew as long as I took care of myself, and I was careful about the things I did and how I did it, and made sure I made my doctor's appointments, I knew that my kids were going to come out healthy, no matter what. And they did. They were both negative, and my husband just having the time of his life with them.
By taking antiretroviral drugs, pregnant women with HIV can reduce the risk of passing it to their child to below 2%.
We have 2 different tests we do here. We have the rapid test, which your results is back in 20 minutes. And then the second one we do takes about 5 business days, so we do that one on Fridays, and you get your result back the following week.
And that's the free test on Fridays?
The free test is on Fridays, and that's the one you have to wait a little longer for.